According to the World Cancer Research Fund International, over 1 million new cases of stomach cancer were diagnosed worldwide in 2020 alone. It is ranked the 5th most common cancer globally. So today, let's learn about some warning signs of stomach cancer so that you can get it diagnosed and get yourself treated before it gets advanced and becomes untreatable. And stay tuned till the end because we'll also share some powerful and quick natural remedies and tips to prevent and even relieve these signs. Let's begin. Number 1. Stomach aches. Let's be honest, stomach ache can happen due to many reasons, so having a stomach ache doesn't guarantee that you have stomach cancer. But if the pain is persistent and isn't going away with typical medications, then it indicates something more serious, such as a stomach ulcer or stomach cancer. Studies estimate that more than 50% of stomach cancer patients experience some degree of abdominal pain. This pain can manifest differently for everyone, but there are some red flags to watch out for. For example, unlike a typical bellyache that fades within a few hours, stomach cancer pain tends to be persistent. It might come and go, but it doesn't fully disappear and can even worsen over time, especially after you have a meal. Another thing to notice is the location of pain. The pain from stomach cancer is often felt in the upper abdomen, right between your ribs and belly button. But remember that stomach aches alone are very common and can have many causes. But if your stomach ache is accompanied by other symptoms that you'll see in this video, be sure to get yourself properly checked. Number 2. Unexplained weight loss. Studies suggest that around 50 to 70% of stomach cancer patients experience unexplained weight loss. We're not talking about a few pounds shed through conscious effort. We're looking at a more significant drop, losing 5% or more of your body weight within 6 to 12 months without any changes to diet or exercise routine. That's a red flag. So, what's the link between stomach cancer and this kind of weight loss? One reason is metabolic changes. Cancer can speed up your body's metabolism, essentially putting it into overdrive. This means your body starts burning more calories than usual, even at rest, leading to weight loss. Another reason is that the tumor itself can physically occupy space in your stomach, making you feel full sooner and eat less. On top of that, tumors in the stomach can seriously damage your stomach's lining. This may not just cause severe pain, but can also hinder your stomach's ability to absorb nutrients from food effectively. This means you might be eating normally, but your body isn't getting the fuel it needs, leading to weight loss. Number 3. Blood in stools. Studies suggest that around 20 to 30% of people with stomach cancer experience blood in their stool. Now, before you panic, it's important to understand that blood in your stool, also known as rectal bleeding, can have various causes. In the case of stomach cancer, the blood often appears black or tarry. This dark color indicates that the blood has originated higher up in the digestive system, like the stomach, and traveled through your intestines, giving it time to break down and turn black. While blood in the stool can be a sign of stomach cancer, it can also be caused by other conditions like peptic ulcers, gastritis, or other gut-related cancers like intestinal and colorectal cancers. Even benign issues like hemorrhoids or H. pylori infection, which is very common, can lead to bleeding. Plus, blood loss can sometimes lead to symptoms of anemia as well, like fatigue and shortness of breath. Regardless of the cause, noticing blood in stools is not something to be overlooked, so get yourself properly checked as soon as you notice that. Number 4. Nausea and vomiting. While these symptoms are common in many digestive issues, let's explore their connection to stomach cancer. Here's the thing. Around 40 to 70% of people with stomach cancer experience nausea and vomiting. Occasional nausea or vomiting after a heavy meal or due to a stomach bug is generally nothing to worry about. However, persistent nausea and vomiting, especially if they last for weeks or months, warrant a doctor's visit. The presence of blood in your vomit raises a red flag. This indicates that there might be bleeding somewhere in your upper digestive tract, which could be a sign of stomach cancer or ulcers. Even when there's apparently no sign of blood in vomiting, if your vomit has a coffee ground appearance, it suggests the presence of older blood that has been partially digested. This can be a sign of bleeding in the upper part of your stomach, possibly due to a tumor blocking the passage of food to the intestines. But why do nausea and vomiting occur with stomach cancer? There can be a couple of reasons. A stomach tumor can interfere with the proper digestion of food, leading to nausea and vomiting as your body struggles to process it. Stomach cancer can also affect the stomach's ability to produce enough acid for digestion. This can also contribute to nausea and vomiting. Remember, nausea and vomiting alone don't necessarily mean stomach cancer. But if these symptoms are persistent, especially when combined with other red flags like blood in the stool, unexplained weight loss, or persistent stomach ache, seeing a healthcare professional becomes crucial. Number 5. Heartburn. Most often, indigestion and heartburn show up as symptoms of gastroesophageal reflux disease, or GERD for short. This occurs when the lower esophageal sphincter, the valve between your stomach and esophagus, weakens, allowing stomach acid to flow back up, causing that burning sensation. But stomach cancer can also mimic these symptoms. A tumor growing in the stomach can put pressure on your stomach and esophagus, pushing stomach acid and food upwards, leading to heartburn-like discomfort. Here's a crucial difference. Medications like antacids, H2 blockers, and proton pump inhibitors typically offer relief for GERD-induced heartburn. However, if your indigestion or heartburn lasts for several weeks and doesn't go away despite using these medications, it might be a sign of something more serious and warrants a visit to your doctor. Number 6. Difficulty swallowing. Swallowing is a seemingly effortless act, but when it becomes a challenge, it can be a cause for concern. Difficulty swallowing, medically known as dysphagia, can be a symptom of stomach cancer, particularly in advanced stages. Studies suggest that around 30 to 40% of stomach cancer patients experience difficulty swallowing at some point during the course of the disease. Tumors located in the upper part of the stomach, or where the esophagus meets the stomach, can physically block the passage of food, making swallowing difficult. This is more common in advanced stages of cancer. In the early stages of stomach cancer, difficulty swallowing might only occur with solids. However, as the cancer progresses and the blockage worsens, you might even experience trouble swallowing liquids like water, or even your own saliva. Number 7. Bloating or swelling in tummy. Bloating can be caused by a variety of factors, including gas, constipation, overeating, or even certain foods. While bloating is a very common digestive problem, studies show that more than 50% of stomach cancer patients notice this sign. Occasional bloating is usually nothing to worry about, but if it becomes chronic, lasting for weeks or months on end, it's time to see a doctor. There are two possible explanations for that. In some cases, stomach cancer can cause fluid to build up in your abdomen, making you feel swollen and bloated. The tumor itself can also be a culprit. As it grows within your stomach, it can take up space and make you feel full or bloated even when you haven't eaten much. So the bottom line is that bloating alone doesn't automatically mean stomach cancer. But if it's persistent and shows up with a combination of other symptoms we've talked about, don't hesitate to get checked by a healthcare professional. Early detection is key for successful treatment in any case. Here are some quick and effective natural remedies to help prevent and relieve symptoms of stomach cancer, stomach ulcers, and other stomach disorders. Number 1. Get licorice root. Licorice root has been used for centuries in traditional medicine to help treat various stomach conditions, including ulcers, indigestion, and heartburn. It has been shown to help reduce inflammation, increase mucus production in the stomach, and inhibit the growth of H. pylori bacteria, which is commonly associated with stomach ulcers. Simply steep 1 teaspoon of dried licorice root in boiling water for 5 to 10 minutes. Strain and drink the tea before meals to help soothe the stomach. You can also consider taking licorice root powder. Mix just a half teaspoon of licorice root powder with water or juice and consume it before meals. Number 2. Enjoy the goodness and sweetness of honey. You might already know that honey has been traditionally used in the treatment of wounds. It's mainly because of its powerful anti-inflammatory properties, which don't just help heal wounds on the skin, but also inside the stomach. Simply take 1 to 2 tablespoons of raw, organic honey daily. You can consume it plain or mix it into warm water, herbal tea, or lemon water. Another powerful combination is honey and cinnamon powder. Mix 1 to 2 teaspoons of honey with a pinch of cinnamon powder. Consume this mixture before meals to help with digestion and soothe the irritated stomach lining. Number 3. Eat more cruciferous vegetables. Vegetables like broccoli, cauliflower, cabbage, and Brussels sprouts are rich in a group of compounds called glucosinolates. Studies show that these compounds can reduce inflammation, inhibit the growth of cancer cells, and may even trigger cell death in cancer cells. Include a variety of cruciferous vegetables in your diet to maximize their health benefits. Mix and match different vegetables in salads, stir-fries, soups, and side dishes. To preserve the beneficial compounds, try to eat cruciferous vegetables raw or lightly cooked. Steaming, sautéing, or roasting them can help retain their nutrients while making them more palatable. Number 4. Avoid these foods and drinks. Spicy foods, processed meats, and excessive red meat consumption have all been linked to an increased risk of stomach cancer. Plus, sugary drinks and excessive alcohol intake can irritate the stomach lining and contribute to ulcers and sometimes even stomach cancer. So be sure to eat a healthy and balanced diet overall. Number 5. Mind your portion size. Do not overeat, regardless of whether you have any stomach condition or not. Overeating can strain your stomach and lead to bloating and indigestion. Eating smaller, more frequent meals can help reduce the workload on the digestive system, making it easier for the stomach to process food and reducing the risk of irritation to the stomach lining. So probably the best way to avoid overeating is to divide your meals into several portions. Take them at different times of the day while keeping in view your daily calorie needs. And most importantly, focus on the quality of food rather than the quantity of food. Choose nutrient-dense foods that are rich in vitamins, minerals, and antioxidants to ensure you're getting the most nutrition from your meals without overeating. Make sure to like this video and subscribe to the channel to support our mission to help improve your health. Thanks for watching, and see you in the next video.